Hello, it's great that you are back and giving us your valuable time. Today, in the format of natural medicine, we are talking about the most important organ in our body. Of course, all organs are important, but our heart is of course a decisive motor in our body, which moves about 7,000 liters of blood in our body per day. And neither you nor I have to worry about that. Everything works on its own, at least as long as the heart is healthy. And that is something we are now talking about with our expert, Dr. Med Heinz Lüscher, orthomolecular medicine and practical doctor. I'm looking forward to the conversation. Stay tuned, it's going to be exciting. Dear Heinz, hello, welcome.
Hello, Alexandra.
It's great that you are back, and I'm looking forward to the conversation. I'm very much looking forward to your expert opinion, or rather your insights, and what is important to us about the heart and how we can keep it healthy as long as possible. When we talk about the pumping force, I already talked about these 7,000 liters at the beginning, which are moved here in our body by our motor, by our heart. Of course, this also requires energy that has to be produced. Where does the energy come from, or how can we support this energy?
Very important question, Alexandra, because most people never think about it, not even the doctors, by the way. The heart simply pumps, and we have learned that this is the sinus node that gives the electric impulses. But think about it, 7,000 liters. If we fill a pool with 7,000 liters, how much electricity do I need so that this pumping force can be produced at all? We have to ask ourselves this question for the heart. The heart beats 100,000 times in 24 hours, which is an incredible performance. This pumping force comes from every single heart muscle cell, and the energy is generated in the mitochondria, in these cells. So if my heart is weak, I have to make sure that this pumping force can be renewed. Of course, there are good drugs, but there are also natural ways to provide the heart with the necessary energy. The energy is produced in the cells themselves, it doesn't come from outside. And in order for energy to be produced, we need the right micronutrients.
Now people think that if everything is fine, and maybe I get everything from my food to produce this energy, but that's not the case anymore. Plants no longer have the energy they once had 100 years ago.
Yes, everything has been proven. It always annoys me when they say on medical TV shows that if you eat healthy, you will have all these nutrients. That's just not true. The measurements are sometimes catastrophic. Certain vegetables and fruits contain up to 80% less minerals than before. And that has a lot to do with sprouting. A tomato that grows in a greenhouse can't absorb as much minerals or other plant substances from the soil if it grows twice as fast. It's so logical. Everyone has that, even if we eat healthy. I try very hard to eat healthy, but I still need certain supplements.
We have deficits, and it can't be attributed to that. We can't say that our way of life has changed. We may no longer be physically challenged in physical actions, at least a part of society. But it's about these substances, these mitochondria, which are like batteries, I imagine, that drive the whole thing to supply the mitochondria. It doesn't matter if I move a lot or not, does it?
It does. I get more oxygen through movement. Oxygen is an important factor for energy production. Every cell has mitochondria. But the cardiovascular cell, together with the brain, has about 10,000 mitochondria per cell. You have to imagine that. A cell is 3 to 4 thousandths of a millimeter, not visible to the eye. And in there we have 10,000 mitochondria. And if they degrade, if they are partially destroyed, maybe 10 to 15% of these mitochondria are destroyed by one-sided nutrition or motionlessness, or for whatever reason, then this cardiovascular cell lacks the energy it needs. And if this happens in every cell, in the end the whole heart is no longer as strong as it used to be. But there are possibilities to strengthen it again.
Let's first look at what happens in the worst-case scenario. What forms of problems do you face in your practice with the heart?
There are basically two main areas. One is the heart weakness, the heart insufficiency, where the pumping force of the heart decreases. The results in a recession. This can recede into the lungs. Then we have a shortness of breath if it gets a little exhausting. If the right heart is constricted, then we have swollen legs. That's how you feel it best. But the cause is that the heart no longer exerts enough force to push the blood out. The other cause is the coronary heart vessels, which are then clogged by arterial calcification, and thus, of course, the blood supply in the heart is reduced. This leads to oxygen and lack of nutrients in the heart. The patient feels this as pain during exertion. This is called an angina pectoris. You have to do something about this, because otherwise you risk a heart attack.
It is often said that heart attacks are already taking place in very young people. Do you also lead this back to poor supply?
Yes. Unless there is a congenital heart failure, a problem. But if you have a heart attack at the age of 35, then this is caused by the circumstances of life, the rent.
Okay. What options are there now, if I am in principle healthy? We have already established that it is important that I also substitute anyway, because I no longer get the substances from the food. What options are there, or what do you recommend to support heart health in principle, and what I can also take permanently, not just temporarily as a cure?
A little broader context. This heart patient, if someone really has a heart problem, he is a cardiologist. He comes to me with 2, 3, for medications to improve the heart. I can't change anything about that. These are good drugs. But you can offer something in addition with micronutrients. And in the case of the heart, the omega-3 fatty acids are above all. There have always been studies that should prove that this is useless. It's a matter of dosage. Do you understand? If I do a study with a minimal dose, it is logical that it is not useful. That would also be the case with drugs. And now, 4 to 5 years ago, there was the so-called evaporate study. With 4 grams of omega-3 fatty acids, especially EPA and DHA, it was proven that the heart's pumping power increases if you take enough omega-3 fatty acids. This is a clear proof. Today it is assumed that omega-3 fatty acids are strengthening the heart. But I have to give enough. The study was done with 4 grams.
Okay. So it's always about, as you say, the right dose.
Yes, very often. Pure school medicine ridicules micronutrients or tells patients that it's all useless. It doesn't hurt either. But that's not true. Micronutrients support us. Now we have to go back to this energy and mitochondria. I want the heart to develop pumping power. And then the mitochondria have to work hard. And to do that, you need hundreds of micronutrients. The study with pumping power was done at the University of Munich. Professor Van Schacke did this study. He is a cardiologist. And I sometimes wonder if a cardiologist finds out something, studies, proves scientifically, that it still get into medicine. Now we vital substance physician have to propagate this and explain it to people. I have hardly seen a cardiologist who supports this so much. But I have great experiences with heart patients.
Okay. So there is no way around that everyone really clarifies themselves individually, if you say so.
Yes.
Such a knowledge.
Most people go to the doctor and say, yes, he already knows what is good for me. I think that's a very bad attitude. Even if the majority thinks so. We are responsible for our own health. And we are responsible to listen around a bit and look, is this really the single best thing, or are there other possibilities that help me? That can be decided by everyone.
Now you are in your practice or in your clinic very individual in the consideration of a client, I would say, thank God. This is an approach that I would wish for everyone. You look at the status of the patient and also his environment and the influences that are still there. What influences are there that you could say in principle that have a bad effect on people's heart health? Lack of movement, probably.
Yes, of course. Lack of movement does not only have a negative effect on the heart, on the whole body. We need movement. Imagine, the cave dwellers ran around all day. They had to hunt to get something to eat. And if they didn't get anything, they had to run around for 5 hours longer. The human being is made to move. And sitting activities or what we do is actually unphysiological. If you have such a job, then you just have to move in your free time. That's number one, also for the heart. But the supply of the important nutrients is also crucial. And we have a one-sided diet. And that's up to everyone to decide if they want to do something to improve themselves. Maybe again about this omega-3. The studies from Munich show that the heart's pumping power can be improved by about 10% with omega-3 fatty acids. That's a lot. Whether I throw out 50 or 60 millimeters with each heartbeat is a huge difference. My experience is that if I have given all the micronutrients, then you can reduce the heart medication.
That's a valuable point.
I'm going parallel with the cardiologist. The patients often have to help the cardiologist a little and say, can I reduce it? Because I'm doing so well. We doctors actually never reduce the medication. Whatever the patient has, he can always have it. And I'm also against that. I want to use a medication until it has had an effect and then, if possible, stop it. With the heart it would be possible, but I'm not allowed to talk the cardiologist into it. The patient has to look at it with his specialist. But I can give him whatever is necessary to make his heart work better.
I think it's fundamentally important when you make such changes that you try to improve the state on the way through the micronutrients before you stop or reduce the medication, that you watch it closely.
Den Zustand wieder zu verbessern, dass man, bevor man Medikamente absetzt oder reduziert, dass man das logischerweise engmaschig überwacht. Ne?
If I'm doing well basically, Do you have a recommendation where you say these or those substances should definitely belong to the basic supply so that it stays that way for as long as possible, so that the heart is healthy and can also ensure the health of the rest of the body, oxygen supply?
Dass das Herz gesund ist und auch für die Gesundheit des restlichen Körpers gut sorgen kann, Sauerstoffversorgung.
I
Das ist
think
ja
that's one of the
alles
most important aspects, that our blood always supplies oxygen to the respective body cells, right?
in die jeweiligen Körperzellen liefert, oder?
Yes, in the heart omega-3 is the key that strengthens the heart pumping power. But there are other things as well. We also know today about magnesium that it is just as important for the heart muscle as for the calf. Many people have cramps in the calves at night, then they take magnesium and it usually gets better. The heart needs just as much magnesium. It's also a muscle. So with magnesium we also strengthen the heart. And the new research also shows from vitamin D that it also improves the pumping power. That would be the case with heart insufficiency. These three important micronutrients again omega-3, magnesium and vitamin D. But now it's also about the atherosclerosis. If I have clogged cardiovascular vessels, then I also have a problem that my heart suffers from oxygen deficiency, but also from lack of nutrients. There are younger patients who have a heart attack, and if you look at the vessels, they are completely permeable. So a heart attack is not just a result of clogged vascular vessels. It also has to do with the micronutrient supply of all cells. And that is still underestimated in cardiology.
Why?
Ja, warum?
Actually,
That is the common theory. A heart attack is the result of calcification in the cardiovascular vessels. That's why you do a stent or bypass operation and then it goes through again and then people feel better. That's true, yes. But that doesn't explain these special cases. And what also makes me shudder is that when atherosclerosis slowly sets in, then a circulation cycle is formed.
Wenn eine Arterienverkalkung langsam sich einstellt, dann bildet sich ein Umgehungskreislauf.
So the cardiovascular artery is then clogged, but if you look at these vessels with blood vessels, then you can see that it is blocked, but 2 seconds later the contrast agent is present in all these circulation cycles.
Da blockt's, aber 2 Sekunden später ist das Kontrastmittel in allen diesen Umgehungskreisläufen drin.
That means the heart muscle is just as well taken care of.
Ist genauso gut versorgt.
This simply shows me that it is not the atherosclerosis alone that leads to a heart attack.
Die zum Herzinfarkt führt.
If there is an acute clot, a cardiovascular artery, then of course a heart attack is the result.
Dann ist der Herzinfarkt die Folge.
But if it happens slowly, there are other factors that play a role.
Hat es andere Faktoren, die mitspielen.
And that's where I want to intervene.
that's why you do such an individual examination of your patient when they come to you, right?
Patienten, wenn man zu dir kommt, ne?
Yes, micronutrients can be measured, especially in the heart. The omega-3 index must be measured.
Index muss ich messen.
If now the cardiovascular vessels are already somewhat blocked, we have learned that you can't do anything to all atherosclerosis doctors, you have to operate on them.
Alle Ärzte, Arterienverkalkung kann man nichts machen, die muss man operieren.
That's not possible.
Man kann die nicht auflösen.
You can't dissolve them.
Auflösen
I can't dissolve it either, but I can stop it or even slightly reverse it.
leicht rückgängig machen.
That is possible, even if it is not confirmed in a purely medical way. But I have seen it, I see it in myself. I have a high cholesterol, I should already be full of atherosclerosis and my vessels are pale.
Nice. Congratulations. So it speaks for a good micronutrient absorption.
Dafür für eine gute Mikronährstoffversorgung.
There are micronutrients that prevent this cholesterol from sticking to the vessels.
Das Cholesterin sich anklebt an die Gefäßwände.
And you have to know them too. Omega-3 is also part of it. Then OPC, that is oligomeric brontocyanidin, or in general, grapeseed extract, but everyone knows this term, grapeseed extract and vitamin K2.
Ja, aber den Begriff kennen alle, also Traubenkernextrakt und Vitamin K2.
K2 has a vessel protecting function.
Schützende Funktion.
So we can protect the inner layers of our combination omega-3, OPC and K2.
Kombination Omega-3, OPC und K2.
And I have been doing this for many years.
Das funktioniert.
And it works.
And this is also something that you just constantly.
Das kann ich
I
deswegen
always
tun.
take this every day.
Das mache ich
I do it
so.
all the time.
Now we have to talk about these micronutrients, we also have to talk about quality. And of course there are these micronutrients probably in all possible prices, but of course also in all different quality variants.
Ja.
I often hear that.
Oft.
A bottle of fish oil that I use costs about 40 francs or 40 euros.
Franken oder 40 Euro.
And then people come to me and say, yes, but with Aldi I get much cheaper. That's true.
Stimmt.
Now you have to see what's in it. I need 2000 milligrams of this special fatty acid EPA and DH.
EPA und DH.
I don't know what's in Aldi. Maybe 150 milligrams. You can buy it there and maybe need 10 capsules to compensate for 1 tablespoon of a good fish oil. Probably the cheap product is the expensive one in the end.
Yes.
And that also plays a role in all omega-3 products the heavy metal release. Because the fish in the sea are heavily loaded with metal and with the good products it is taken out and with the cheap ones not. So it's worth keeping your eyes open here.
Is there, if now someone says he wants to eat vegan and wants it from a vegan source, is there an adequate replacement?
There is the algae oil. But the two fatty acids EPA and DHA are very unevenly distributed. Algae oil consists of almost 100% DHA, and unfortunately that doesn't have the same effect in the heart. In the heart I need mainly EPA. In the brain I need more DHA. For brain patients the algae oil is an alternative. For heart patients rather not. With heart patients unfortunately I have no vegan alternative anymore.
Yes, but we just have to talk about it because it is also important to know that.
Yes. I respect vegan diet. In many respects it is very good. But when it comes to heart health and you stick to your ideology, that doesn't make sense to me anymore. But everyone has to decide for themselves.
Exactly, everyone has to decide for themselves. I also found it important that you can buy things cheaply, but you also need more of it. I imagine it like in a cooking recipe. If I use an ingredient of which I actually need 100 grams and I only use 10 grams, then I don't get the same result. It is logically, you can count on a few fingers that it doesn't go right. That's why it is important to find a good source of reference. Can you recommend something?
I work with products of the company King Nature. I know the production and the quality. In the beginning I even helped the company in the development of the products. We need quality products in medicine. I understand when the doctors say that the stuff is useless. There are really products that are useless. And that's a shame for the patients when you buy something because you think it's good, but it doesn't have much in it. Especially with vitamin K2, the company did research and bought competitor products and had them examined in the laboratory. There was almost nothing in it. What was on the packaging was not in it. With this company everything is correct. That's important for me that I can rely on it.
Yes, definitely. Also for our viewers.
Yes, for the patients. I'm really just like with a medicine, we know that what's on it is in it. That's just as important with food supplements and natural products.
Yes. You are a practicing doctor yourself. Where can I find you when I want to visit you or your team and want to have a look from you, analyze myself, examine and check my status?
Anschauen lassen,
Ja.
analysieren, untersuchen lassen
Genau, also wir
und
sind
meinen Status
eine
überprüfen.
We are a medical center.
Nicht nur, ich habe keine
I don't have a
Praxis,
single
sondern ein
practice.
großes Zentrum in Winterthur,
We have a
das
big
heißt
center in
Wise
Winterthur
Medicine,
called
eine
Wise Medicine, an
integrative
integrative clinic.
Klinik.
Cardiologically, we are not optimal in
jetzt in
Winterthur.
Winterthur nicht optimal aufgestellt. Ich
We
kann
can
aber
measure all these
diese
micronutrients.
Mikronährstoffe können wir messen.
But we have a cardiologist in the center in Brugg, Aargau.
Im Aargau.
The medical director is a cardiologist himself. If you want to have a cardiological examination, you have to go to Brugg.
Abklären lassen möchte, dann müsste man nach Brugg.
If it's just about measuring micronutrients for the heart, you can come to Winterthur.
Zu besprechen, dann kann man nach Winterthur kommen.
Yes. I think your name is so beautiful. I keep saying the Wise Clinic. WISE stands for wisdom and above all the integrative, that you don't just pick a single aspect from a patient, but that you try to grasp him wholeheartedly and to see him on all levels.
Dass ihr versucht, ihn wirklich ganzheitlich zu erfassen und ihn da auf allen Ebenen dann zu sehen.
What are the influences? Why does a disease develop?
The word integrative means that we integrate the environment of the patient, his psyche, his mental constitution, and we integrate natural micronutrients into the medicine.
Und wir integrieren eben natürliche Mikronährstoffe in die Medizin.
Natural is very important. That's the aspiration, that everything comes back to nature again. At least for humans. Would it be the desire?
My impression is that there will be more and more patients who think about it. There are still few. I think there are barely 10% of all people. But there are more than 10 years ago who are looking for something like that.
And above all, to be taken seriously and to really get time from the therapist and the doctor. And that's the case with you, as I have been told.
That's the way it is. That's the way it should be.
Exactly. That's why I thank you very much for your mission, and that you also share your thoughts on how important quality is and how important the right dosage is when I take something. Because otherwise something gets a bad reputation very quickly. Like, I took it and it didn't work. And it's always about supplementing the right dosage. Very important. Thank you for your mission and for your work.
I wish you all the best.
To keep it up for a long time. And that many of your colleagues, your medical colleagues, will also bring this philosophy to consciousness.
I try to pass it on.
That many people join and implement it the way you do it. And I hope you also had a good inspiration for your heart health. And that it's not always important when your heart is alarming with a special reaction or a reaction that is simply not healthy for the rest of the body. It is not only then that it is relevant to do something good to our heart, but basically from an early age, because in our diet we simply no longer get the quality or the substances that our heart needs, so that we can grow old as long as possible without any complaints, ideally healthy.
Beschwerdefrei, gesund im Idealfall alt werden können und unser Leben genießen können. Das ist vielleicht fast noch wichtiger.
In this sense, please stay healthy and take good care, especially of your heart. I look forward to seeing you again next time and wish you all the best.
Until then, goodbye.